It's been 2 days since the FDA approved the over-the-counter sale of Narcan. The nasal spray has long been a resource to reverse opioid overdoses.
13 on your sides. Trevier Gonzalez joins us from the Medical Mile Live this morning. Trevier, we know you spoke with one doctor here in West Michigan. What's that doctor saying?
Hey, Emily J. Yeah, the doctor I spoke with says the reality is that people continue to lose their lives as a result of this opioid epidemic. And while there's much more work to be done, this is something that does provide a sense of relief. Now, I spoke with a Dr. Khan over with Pine Rest Christian Mental Health Services. He says this is good news when it comes to the opioid crisis, but says the work is far from over. Affordability and access is still something that needs to be addressed. Bringing down the price is something that could also be done with assistance from the state. But those efforts really shouldn't stop there. He adds there needs to be more education publicly so that people don't feel ashamed asking for help and really stop the stigma that might be associated with purchasing Narcan.
So it has to come in really early, maybe in school. That's where destigmatizing of mental health and addiction treatment has to happen really early. It can happen in churches, in community centers, making it available to the average person.
When we talk about the overdose-related deaths, the opioid fentanyl is the drug that we tend to hear in dominating the headlines. Dr. Khan says fentanyl is actually 50 times stronger than that of heroin, and that Narcan is not nearly as effective as in a treatment. So at the same time, this approval does provide some level of hope, though again, more work needs to be done. We're live here in Grand Rapids. Trevier Gonzalez, 13 on your side.